fundamental as comparing alcohol and marijuana in terms of the relative potential harms. I mean, I just don't think, even if you grant that marijuana may not be good for some people who are vulnerable to mental illness. I mean, even if you grant that, and I think many of those arguments are actually
I wouldn't be able to. You're a professional, but I wouldn't grant that for a moment. But
okay, well, even if you grant that, still the amount of damage done by alcohol, and not because it's legal, and not because it's so widespread, but because it fundamentally is toxic to the human body, to every organ system there is.
You bet.
You know, cannabis can't possibly compare to alcohol in terms of that level of damage. So the way in which we have, you know, the hierarchy of the way substances are ordered in terms of access and dangerousness doesn't make any sense. So that's the second. Matter of fact, Lancet, one of the most respected journals in the world, medical journals, called for a global response to the alcohol misuse problem back in early 2009. So, you know, the second trajectory is the growing recognition that we've created. You know, we've electively created a public health problem, and while not doing very much good in conducting the current war on drugs. And then the third trajectory that I say is converging with these other two in Cannabinomics is the economic trajectory, which would essentially boils down to recognizing that, you know, we can all agree, whether you're on the political left or the political right, we can all agree that we're in a major economic crisis. It's been compared multiple times to the Great Depression, and of course, what happened several years after the Great Depression, alcohol prohibition was repealed. So we're at a time where recognition of new value in the economy is critical, as is the appropriate management of our commodities and resources. Right. So we can drill down, you know, later if you'd like to, into why I think these three things connect, but it's probably obvious to a lot of listeners that these three trajectories do interconnect.
Very, very perceptive. This is a unique and extraordinary book, and I hope all of you who have an interest in this, or even any of you who have a disgust for the big pharma monolith, which is grinding up human lives as fast as they're born practically, would get behind this. We really need to identify the enemy, which is continually holding the gate closed against us, and dismantling that resistance. It's a tough call. We'll come right back with Dr. Chris Fichtner in just a couple minutes. This is, again, a remarkable book. Stand by.